Hi everyone, it's Lenore Kubasarian-Mazenko, and this is Medicare 101. Today we're going to go over Medicare, all the general parts. This video is designed for those folks who are brand new to Medicare, going on to Medicare, maybe you're helping someone go on to Medicare, or maybe you just want a general refresh and some basic questions answered. Here is our agenda. We're going to go pretty quickly through this. We're going to talk about Medicare, who it's for, the original parts of Medicare, A and B, how you can get Medicare or when to enroll in Medicare, when does Medicare start, the major exposures of Medicare and what you can do about it, what your Medicare options are, the difference between a Medicare supplement plan and a Medicare Advantage plan, also called Part C, what a prescription Part D, like dog or drugs is, what Medicare does not cover, and how you can and what you can do about it. And we're going to expose some common myths about Medicare. But you want to stick around to the end because we're going to go over some bonus stuff, how you can protect your savings in retirement. Before we get started, I want to introduce myself. I've been helping people figure out insurance for over 30 years. I started my career in human resources right out of college. I started helping people with insurance as a benefits administrator, and I worked my way up through corporations, companies like Coca-Cola, Kraft Foods, Entenmann's, Graybar Electric, and some small mom and pops. I've also been an adjunct business professor. I have an MBA. I was a business coach, a team builder, a small business owner, and for the past 15 years, I've been helping people figure out Medicare. We help people take the scare out of going on Medicare. So a little bit about who we are and where you can check us out online at the MedicareAuthority.com. That's the website. You can go to my Facebook page, Lenore Kubasarian, the Medicare Authority. You can also look at our Google reviews. We have over 400 of them. You can see what people are saying about us. Also, we'd like to welcome you to like, subscribe, and leave comments below. That helps us get more information out to people, also answer questions and go over topics that you might be interested in. And at any time, you can always call for an appointment. The information is below on contacting us directly by email or to call us. All right, so let's get started. What is Medicare and who is it for? Medicare has been in place since 1965. It has been an evolution. It is health insurance for people 65 and over, people under 65 with certain disabilities like ALS, Lou Gehrig's disease, kidney failure, and those folks disabled under 65, they may be eligible for Medicare as well. So original Medicare, as I mentioned, started in 1965. Medicare is not like regular insurance. It is broken up in two parts. Part A is hospital coverage. No monthly cost for Part A as long as you have the work credits, which is basically about 10 years of work and 40 quarters of work. You'll pay nothing for Medicare. Part B, which is your medical coverage, does have a monthly cost that starts at $185. It could be higher, and every year this cost goes up each January. So if you're listening to this after 2025, we may have a higher cost in the next couple of years. All right, so original Medicare Part A, hospital. I just want to get a little bit deeper into this. It really is designed to cover the room and board of a facility. Semi-private room, operating and recovery room, intensive care unit, general nursing services, lab tests, x-rays, drugs furnished in the hospital, medical supplies, appliances like wheelchairs. This is all while you're in the hospital. This is what Part A covers. Now, certain things will be covered under Part B, like doctor's fees. So if you're in the hospital and a doctor sees you, that's covered under Medicare Part B, like boy, not A like apple. Private duty nursing, also not covered under Part A. Private rooms, unless it's medically necessary. Personal convenience things like radio, TV, telephone while you're in the hospital. Those things are not going to be covered by Medicare Part A, and oftentimes people don't realize Part A does cover you while you're in a skilled nursing facility, but for a short period of time, so it doesn't cover long-term care or custodial care. Now, Part B, that's where the majority of your medical stuff is really falling. This is going to cover your doctor services, which includes at-home doctor services, in a doctor's office, in a hospital, in a nursing facility, diagnostic test, immunosuppressive drugs, administered drugs like infusions, injectables done in a doctor's office are covered under Part B. Anesthesia fees, assistant surgeon fees, outpatient surgeries, also services, include emergency room, hospital clinic services, physical and occupational therapy, speech pathology, administered drugs, medical supplies, x-rays, lab tests, radiology received as an outpatient. Supplies and other services include independent lab tests, ambulance, pacemakers, artificial limbs, braces, wheelchairs, necessary equipment, corrective lenses, cataract operation, surgical dressing, and cast iron splits. So this is not an all-inclusive guide, but you can see there's a lot here that Medicare Part B, like boy, covers. What doesn't it cover? Okay, it doesn't cover routine dental care. It doesn't cover routine exams. We have a Welcome to Medicare exam, but what you and I think of as a regular routine exam is not covered by Medicare, although they do cover preventative services 100%. So to get a complete list of that, you can go to Medicare.gov. That's the government's website. Other things that are considered routine, like foot care, eye care, ear exams, not covered. Oral or cosmetic surgery. Sometimes people are getting things done to their teeth. Oral surgery is not considered medical under Medicare Part B. That would be something different, dental. Healthcare while traveling outside of the United States. If you're out of the United States, you're not giving them your Medicare card. Medicare only covers you while you're in the United States. Also, things that are not medically necessary. Now, Medicare does have a black and white rule of what they cover and what they don't cover. So if they don't find it medically necessary, it's not covered. First aid supplies, glasses, and hearing aids also not covered under Medicare. So when do you get Medicare? Well, most of us would get it either when we're turning 65 or when we're coming off an employer health plan when we retire. So we have 3 different scenarios here, which we're going to go over. And some folks are going to automatically be enrolled. That is scenario 1. If you're currently receiving Social Security benefits, you will automatically be enrolled in Medicare Parts A and B, so you don't have to really do anything. You're going to receive that red, white, and blue Medicare ID card about 3 months before your 65th birthday, and they're going to take the monthly premium of Medicare Part B right out of your Social Security check once it starts, in the month that it starts. Now, for a lot of folks, we're delaying going on to Social Security because we're still actively working, but maybe we don't have coverage through our employer. Maybe we have coverage through the exchange or the marketplace, not getting Social Security benefits. You guys are going to have to manually enroll in Medicare. You're going to do that by going to the Social Security website. The address is listed right here on the screen. You can also make a phone appointment, or you can visit your local office. You also have the ability to fill out a paper application. The best way to apply for Medicare is going to be on the Social Security site, ssa.gov. You're going to go log into the site. We have another video on how to do that, but you're going to go online and apply for Medicare online. That's the best way to do it. The phone call is going to get you on hold for somebody who will schedule an appointment about 2 to 3 months, maybe not 2 to 3, but about a month after you're ready to start. If you do have unusual circumstances, like maybe you weren't born in the United States or you don't have enough work credits, that's when you're going to go down to the local office because you're going to have to present documentation to get yourself enrolled. But for the most part, most of you are going to sign up online. Now, if you're not getting Social Security benefits and you want Medicare, although Medicare and Social Security are linked, you're going to go ahead and apply, and you will get a paper bill. The paper bill is typically for 3 months of premium. So don't be surprised when you get that. Now, the final scenario is if you're still working and have coverage through the employer, whether it's your employer or a spouse's, as long as the employer has more than 20 people, you can delay going on to Medicare. You'll typically just sign up for Medicare Part A only and delay the Part B. When you're ready to sign up for the B, you're going to do that about 3 months out. The reason why folks do not pick up Medicare Part B if they're still actively working or they have coverage through a spouse who's actively working is because Medicare will be more expensive than being on their employer plan. We can set up an appointment with you if you're not sure about this to do the math, but that's really what it is. We just compare the cost of being on Medicare to the employer plan. So when does Medicare start? Well, it will start the first day of the month that you're turning 65. So for example, my birthday is in April. Medicare would start April 1st for me. If I'm getting Social Security, I'm automatically enrolled and they'll set it up that way. If I am applying online on the Social Security site, I don't have the option to say, please start my Medicare this date. It's going to default to the first day of the month that I turn 65 or the first day of the month after I apply. If I'm delaying my Medicare B, there's a special process. There's an application I have to fill out for Part B. In there, on the Part B application, I'm going to have to put the date I want my Medicare B to start, and that's the only time I really can future date it. Now, if you're not sure about that, again, we do have another video on how to apply for Medicare. If you're splitting your application, you're signing up for A only and B later. So Medicare, even though it's been in place since 1965, it doesn't cover everything you need. And there's a good chance that you're getting a ton of information if you're turning 65 about Medicare, and maybe you're not really sure. Well, it's no secret that Medicare was never intended to cover all expenses, or maybe people aren't aware of that. Some of those expenses can add up pretty quickly. That's why it's important to know that you're going to do something else with Medicare. The major exposures of Medicare is that there are no out-of-pocket maximums with Medicare A and B. So even if you sign up for A and B, we have a hospital deductible of $1,676 every time you're admitted to a hospital. The Part B, the medical deductible is $257 per year, and then Medicare pays 80% of the bill. You're going to pay 20%. So let me give you an example. If I just have regular doctor visits, I've met my annual medical deductible of $257. Paying 20% of my office visit is not really a lot. If I have a $300 office visit to my doctor and I have to pay 20% of that, that's $60. If I have a $100,000 knee or heart replacement, on the other hand, a knee replacement or heart surgery, on the other hand, and I'm hospitalized, that's where my exposures are much bigger. I have that $1,600 hospital stay deductible. Then I have my medical deductible if I didn't meet it. Medicare is going to pay 80% of that $100,000, and I'm going to be responsible for 20%, which is $20,000. So that's not really ideal. It's a little risky. So we basically have two options. We're going to have original Medicare no matter what options we choose, but we're going to be able to choose to buy a Medicare supplement plan, also known as Medigap, with a Part D drug plan, or we're going to have a Medicare Advantage plan, and that plan may include prescription drugs. So there are two paths. We like to say that you have the Medicare Supplement versus Medicare Advantage. People get these two options confused so often. So here we go. Let's compare the two, just top line, and we're going to go a little bit deeper here as we talk about both of these. A Medicare supplement plan, also called Medigap or secondary insurance, is designed to do just that. It's designed to supplement, fill in the gaps, or pay the bills second to Medicare. This is going to have the lowest out-of-pocket costs when you see doctors. You still have to pay your Medicare premium, Part B, but you will pay an additional cost on top of that to have that extra secondary coverage. This gives you the ability to choose any doctor that is contracted with Medicare in the whole United States. So you're not restricted. Typically, there's really no networks to see doctors, no referrals necessary. It's a very flexible way to have your Medicare. You will have to choose a Part D drug plan because that is not included with the Medicare supplement plan. The other option we have is called Medicare Advantage, also known as Part C, like Charlie. This will have higher out-of-pocket costs when you see doctors, but typically does not have a monthly premium on top of Medicare. No matter which option you choose, you still have to pay your Medicare B premium. So that doesn't go away. A lot of times people think, oh, I'll choose that Advantage option. I don't have to pay anything. Not true. You still have to pay your B option. But instead of Medicare managing your care with the Advantage plan, the Advantage plan is going to do that for you. In this particular option, doctors don't have to take the plan. So you may have to choose a doctor who is contracted with the plan. You may need a referral, so it's a little bit more restrictive, and then you're paying as you go. So you're saving on the upfront costs, but you're paying as you go, and oftentimes this option will include the prescriptions. So let's take a little bit deeper dive into the option one, which is known as a Medicare supplement or a Medigap plan. In this option, we have original Medicare, A and B. They are paying the bill first. The Medicare supplement plan is going to pay the bill second, and then we have to have a prescription drug plan. This is a chart that is put out by Medicare itself, by the government. It's showing the Medicare supplement or gap plans lettered A through N. We have Plan G highlighted, but the other plan we do recommend often is Plan N, like Nancy. Now, these plans are standardized by the government. The government does not sell the plan, but they standardize a plan, so every G plan is exactly the same regardless of who you buy it from. Okay? So the plans we recommend, Plan G, Plan N, which one is best? It really depends on you. One is not better than the other. One option is not better than the other. Typically, the G plan is going to cost anywhere about $100 to $200 a month. The cost of the plan is based on your age, whether you're a man or a woman, and your zip code where you live. So when we ask you those questions, your zip code, your date of birth, it's because we're trying to get you a quote for the Plan G or the Plan N. Now, with the Plan G, everything is covered with this plan. You're basically only responsible for the Medicare Part B deductible of $257. The Plan N, on the other hand, is typically cheaper in the monthly premium. It's going to be about $30 to $40 less in the monthly cost. That's because it's going to add a copay of $20 for doctor visits and $50 for the emergency room. And in some parts of the country, you will pay what's known as a Part B excess charge, okay? So, Plan G, Plan N, the average cost of these plans will be about $100 to $200 a month based on your zip code and the insurance company you choose. The best time to enroll in one of these plans is 6 months prior to your 65th birthday, 3 to 6 months when you're getting ready to sign up for your Medicare. That will get you the best rates to avoid any mistakes, and you can check it off your list, really. These plans, as we mentioned before, they are standardized. They're federally regulated. The coverage follows the letter of the plan, not the company offering it. So Plan G coverage is exactly the same regardless who you buy it from. These are some of the companies that we represent, all listed right here. There are probably more that we miss, but we do our best to be contracted so we can competitively offer you the best prices on these types of plans. So when you choose a Medicare supplement plan, you are covered first by Original Medicare. They're going to pay 80% of the bill. The Gap plan is going to pay the 20%, and you do need a prescription drug plan. So let me give you an example of that. Let's say you had that $100,000 knee surgery and you have a G plan. Medicare is going to pay the bill first. They're going to pay 80%, and your G plan is going to pay 20%. The G plan will cover the 100% of your hospital deductible. That's $1,676 deductible. It's going to pay it every time. It's going to pay for an extended stay in the hospital, so you won't get a bill for the room and board of being in the facility. It's also that G plan is also going to cover the 20% Medicare doesn't cover, so you're simply responsible for the once a year $257 deductible of Medicare Part B. Now, if you choose the Medicare supplement option, you will need to add a prescription drug plan. So that is really important. A lot of folks, you'll start off by asking me, well, I need Part D, I need Part D. Definitely, because there is a penalty if you don't take a Part D drug plan, even if you're taking or not taking any prescriptions, you need to add a Part D drug plan. All right, so we're going to add a drug plan, and all Medicare drug plans are standardized in a certain way, meaning that there are basically 3 stages of a drug plan. You likely will have a monthly premium for the Part D drug plan. So it may cost $0, it may cost $100. The national average for a drug plan is around $40 a month. And when you go to the pharmacy, you will pay for your prescriptions. In general, a generic prescription will have a low monthly cost, $0 to $5 a month. A more expensive medication will cost you more. So when you're buying a prescription plan, the next slide we're going to go through will go through the process. But when you're buying a prescription drug plan, we look at the total cost of your prescriptions and the total cost of the plan combined. When you go to the pharmacy with these plans, you may have a deductible on the plan. The lower cost plans are going to have that deductible. It can't be more than $590 in 2025. Okay, so if you have a deductible on the plan, you'll have to pay the full price of the drug up to that price. Then you go into what's called an initial coverage stage, where you may still have to pay a portion of the drug. Maybe it's a tier 3 level drug. You'll have to pay $50 for that drug, or 25% of the drug cost. Once the cost of your medications reaches what's known as the catastrophic phase, or $2,000 out of pocket on your end, then you go into that catastrophic phase and you pay nothing for your drugs. Now, prescription drugs are very confusing, just understanding the whole concept of that, and I encourage you to hit the buttons below, schedule an appointment if you want to talk about your prescription drug plan in particular. Here's what we do to go over prescription drugs for you. We take your drugs. You have to give us permission through something that's called a scope of appointment. We're HIPAA compliant, number one. All your stuff is confidential. but we take those prescriptions and we put them into the Medicare online plan finder. We also have some internal tools that allow you to put your prescriptions in place for us to look at them, but we generally use Medicare.gov to determine which plan makes sense for you. We also look at the pharmacy choice. What pharmacy do you like to use? There's some major chains, some mom and pops. So we also put that into the plan finder, your zip code, and then we figure out the overall best combination for you by putting all that information into the Medicare.gov site. We compare and then we actually enroll you in the plan. We reevaluate that every year, so we want to let you know when we look at your medical stuff, we reevaluate Part D every year, October 15th to December 7th. So very important, if you don't enroll in a Part D drug plan, there's a penalty for 1% penalty for every month that you could have enrolled in a plan and didn't. You want to avoid it, so we want to make sure you have that Part D. All right, so let's recap. How much does this cost to have this scenario? Well, no matter what, you're paying for your Medicare B, $185. You're adding on that G plan, anywhere from $100 to $200 a month. It varies by zip code. And then you're adding in the prescription plan, possibly another $40 a month. That's the average. The other option we have is called Medicare Advantage. These are also known as Part C like Charlie. Now, this is an HMO or a PPO. It's a managed care. There are networks of doctors. You still have to sign up for A and B. You still have to pay for your premium of B. But instead of Medicare paying those bills, all your care is managed by whatever company you choose. In some cases, we have 80 different plans that are available to you. In these plans, though, there are some generalizations we can make. You might require prior authorizations. You may be required to use specific doctors. Not all doctors are participating in every plan. So what else can we say about these Advantage plans? Many of them are low in cost. They don't have a big upfront cost. Some of them are zero. If they do have a monthly cost, it could be as low as $20, $30 a month. Some plans may cost $100 to $200 a month, but most of them will be low on the front end, and then you pay as you go. You'll have co-pays. Typically, things like doctor visits can be pretty inexpensive, $0 to $50. You may have deductibles on certain things. But all Medicare Advantage plans must have an out-of-pocket maximum, meaning if you're going for procedures and services, you're paying those co-pays, co-insurances. Once the amount that you personally pay out of your pocket reaches about $7,500 for in-network services, you reach your out-of-pocket maximum and you have zero co-pays after that. If you're out-of-network, it's higher. It's typically around $12,000 for in and out combined. Now, those of you who are choosing the Medicare Advantage option, we always recommend umbrella policies like a hospital indemnity to protect you, because the hospital is one of the bigger costs when we have Medicare Advantage. Some other things about Med Advantage plans is that they're based on zip code where you live. So those of you who may live in two different places, maybe you have a place in another state, you're buying this plan or you're enrolling this plan based on where you live initially. It's based on your zip code. It's not a portable plan. Not every doctor takes these kinds of plans, so you want to make sure that when you're choosing this plan, we look at your doctors, your specialists, your hospital, and your prescriptions to get a match. Sometimes we see a nice TV commercial, it's enticing. Well, the most important thing in choosing this kind of a plan is matching your doctors and your prescriptions. The Advantage plans oftentimes give us extra benefits. We get some dental cleanings, 100 to 200 of eyeglasses. Not all plans give hearing aids. This depends on what part of the country you're in. We typically do get a gym membership. Again, transportation is one of those benefits that not in every plan. Meal delivery after you've been admitted to a hospital upon discharge. They typically give you some type of a meal sent home with you. There are buyback plans, plans that will pay a portion of your Medicare Part B premium, and then other plans will give us some spending card for over-the-counter drugs or prescription, non-prescriptions, I should say. This will vary by area, so this is real important. If you'd like to schedule an appointment to look at some of these plans, we're happy to look at them. Just a disclosure, we're not contracted with every company that offers plans in every area. In fact, some companies don't let us be contracted, but we do our very best to be contracted with as many as we can so we can assist you in choosing the right plan. You can go to Medicare.gov to look at these plans as well if you like. All right, so when do you sign up for these plans? How do you sign up for them? If you're new to Medicare, you can sign up then. Oops, we seem to have a little glitch. Yep. If you're new to Medicare, you're going to sign up 3 months before your 65th birthday. So when you get your Medicare ID, we're going to go through all the different plans together. We're going to look at them and we're going to analyze to determine which plan is best for you. The other time we sign up is each year between October 15th and December 7th. If we make a change, then the plan change is effective January 1. So the October 15th to December 7th timeline is to change to a Med Advantage plan or to change your Part D drug plan. It is not to change the Medicare supplement plan. And if you're confused on that, it's okay. Again, you can always schedule an appointment. We can go over that a little bit more thoroughly. All right, so let's compare the two options. Again, with the Medicare supplement plan, under either option, you're signing up for Medicare A and B. Under the supplement Medigap plan, secondary plan, this has a monthly premium on top of Medicare. It gives you the lowest out-of-pocket cost, so something like $100,000 heart surgery, once you've met your deductible, typically doesn't cost you anything. No out-of-pockets for hospital or medical. It gives you the ability to choose any doctor contracted with Medicare across the United States. Mostly all doctors, hospitals, medical professionals take Medicare. So you wouldn't need to worry, does my doctor take this? If they're taking your plan now, they're likely going to take Medicare. You do have to choose a prescription drug plan, and you don't get any of the extra benefits here with this Medicare supplement, Medigap, wraparound, secondary, whatever the heck you want to call it. You don't get that. With the Medicare Advantage plan, you're still paying your Medicare B. And instead of having a monthly premium, most of the time you're paying $0 on top of Medicare for these Advantage plans, but you have higher out-of-pockets. Not all doctors take every plan, so if you had a major procedure, $100,000 surgery, you're paying co-pays up to an out-of-pocket maximum, which can be around $7,000 to $12,000 out of pocket. Once you reach that, then you go to $0. This type of plan does give you extra benefits. It does give you typically the Part D drug plan. So let's talk about filling in the gaps, because under either option, we definitely have gaps. The first gap, and a lot of times people really overlook this. The biggest things people ask me for outside of I need to sign up for Medicare, they all ask me for dental hearing. I need a plan for that. But there are other gaps that people often overlook. Number one, Medicare does not cover long-term care. Medicare does cover cancer, does cover heart attack and stroke. However, your out-of-pockets, especially in a Medicare Advantage plan, can add up with these kinds of things. So you likely will want to add something extra if you're choosing that option. The hospital indemnity, that is highly recommended for those of you who are choosing a Medicare Advantage plan, because the copays for the Medicare Advantage plan hospitalization are as high as $300 to $400 a day. So according to the Consumer Financial Protection Bureau, approximately 66.5% of bankruptcies in the United States are caused by medical bills. This means that medical debt is the leading cause of bankruptcy in the country. So we want to make sure that when you're signing up for Medicare, we're filling in the gaps for everything that you need, not just signing up for Medicare itself. What is long-term care? It's no secret that Americans are living longer today. That also means the likelihood of serious medical problems increase. Conditions like stroke, Parkinson's disease, Alzheimer's disease, and crippling arthritis, even accidents or injuries, can require a lot of care for a lengthy period of time. This is called long-term care, and it's the kind of care you would need if you are unable to care for yourself independently. And I think that's an important thing, independently for daily tasks like eating, dressing, bathing, going to the bathroom. Time. Right now, the government is paying 71% of long-term care costs in our country. That's who's paying for the majority of long-term care, which means that folks who have the government pay, that's a Medicaid asset. Medicaid accounts for the bulk of that spending, averaging $207 billion annually. That's 44%, which who pays for long-term care? Right now, the government is paying for 71% of long-term care costs in our country, which is totaling around $333.6 billion annually. Medicaid, which is a low-income subsidy, accounts for the bulk of that spending, averaging $207 billion yearly, with Medicare coming in about half. So Medicare is not covering the long-term care. Medicare is paying about 92.6% versus Medicaid, $207 billion. Do you know how many baby boomers are turning 65 each and every day? Want to take a guess? It's about 10,000 boomers turning 65 every day. If you combine that with the fact that every 68 seconds someone is diagnosed with Alzheimer's in this country, you have a collision course waiting to happen. Here's what Medicare pays and what you pay. Now, we've gone through Medicare, but Medicare does not pay for long-term care costs. Fact, generally, Medicare does not cover long-term care. Medicare pays only for medically necessary skilled nursing facility or home health care. And that's if you meet very specific conditions. For example, in order for Medicare to pay for skilled nursing care in a facility, you must be sent there directly after a hospitalization that lasts a minimum of 3 days. Many times there is no prior hospitalization to someone needing to go into a nursing facility. And most long-term care is to assist people with support services such as activities of daily living like dressing, bathing, using the bathroom. Medicare never pays for this type of care. That's called custodial care. Also fact, Medicare supplement insurance plans designed to work hand in hand with Medicare. A lot of folks choose Medicare supplement gap plans. They help cover a little bit, 21 through 100, but they are not designed to cover long-term care in your home or in a facility. So they're not going to cover that. So a lot of folks think, well, if I'm healthy, I won't need it. The fact is, the reality is 40% of those receiving long-term care services are now ages 18 to 64. Wow, that's incredible. 40% of those receiving long-term care services are now ages 18 to 64. For every 1,000 people, nearly 600 will require some type of long-term care. With everything that we discussed so far regarding long-term care, unfortunately, most people would rather not think about it. It's a ticking time bomb that will directly affect as many as 70% of married couples in retirement. We're talking, of course, about the sky-high costs of long-term care. While it's not a pleasant topic for everyone to consider, Me too, us included. The bottom line is that even a substantial nest egg you've been saving all your life, it can be decimated when the cost of long-term care can reach $15,000 or more a month. On that note, we'd like to share a story with you which is near and dear to us. My father-in-law, Andy, broke his foot in his home. Didn't want to tell us because he didn't want to be taken out of his home. He was under age 65 when this happened. He literally was crawling around on his kitchen floor for 2 weeks on all fours because he broke his foot and he couldn't put any weight on it. He didn't want to let anybody know about his issue. Being scared, confused, he ended up doing what most seniors do. He tried to tough it out and hope it would improve. See, my father-in-law Andy's greatest fear was going into a nursing home. Thankfully, he found out about his conditions from one of our cousins. My husband Scott, one of his cousins called him and he said, you know, your dad, he needs help. He's been asking me to take him to the doctor. And we were completely taken off guard because we had talked to him every day and he did not tell us what was going on. So my father-in-law, who lived 100 miles away, wasn't just a 15-minute car ride for us to take care of him. It was a total nightmare for us. We really had to try to figure it out. Unbeknownst to us, Andy, my father-in-law, he had abrasions from crawling on the kitchen floor, which developed into a severe blood infection and caused dementia sundown symptoms. So he had an infection and he wasn't really in his right mind. In less than 24 hours, we moved my father-in-law, Andy, from our house into a hospital, into the intensive care. He was in the hospital for 3 weeks. Now, my father-in-law didn't want to come to our house, but we were like, well, we can't take care of you in your home. You live 100 miles away. And we brought him to our house to just see if we can get him better. And we had to take him to the hospital because he wasn't in his right mind. On a side note, my father-in-law also never implemented a will or a power of attorney. So my husband and I were left powerless to make any of his medical decisions while he was suffering in the hospital with a massive blood infection. After he was released from the hospital, he was transferred into an assisted living facility for 92 days. He was in that nursing home for 92 days, and eventually we got him out, but they wanted to keep him in there. Medicare only covers you. He had a supplement, Medicare and a supplement. Medicare only pays up to 100 days. So if he had gone past that 100 day, he would have, or we would have, been responsible for paying the full cost of his care. My father-in-law eventually, he came home with us, and it took about 6 months before we brought him back home. It took 6 months, and in less than 8 months, he passed away. He passed away from congestive heart failure. He really didn't want to take care of himself. We tried to take care of him, but he wasn't able to. And this is a very sad story. It kind of breaks my heart because he was young. He was only 66 years old when he passed away. This experience really opened our eyes, and we really know how important it is to get information out to people so that they can prepare for what they might need, long-term care. And we understand the value of educating you, and we want to make sure that you have the right information to make tools we want to make sure that you have the right information to make some decisions for yourself. So with that in mind, we put together this free report, or actually Scott did, 10 crucial things seniors and children of seniors need to know about long-term care. You can get the free report right in the description below, but you can go to www.getltclongtermcarereport.com. Don't hesitate, really. You want to just download it, take a look at it. In the report, we'll share little known strategies that could make the difference between your independence and your ability to stay at home and select who your caregivers are instead of having someone else do it for you. Here's just some of what you'll discover in the free report. What your biggest financial threats can be and how to help overcome them. The do's and don'ts of long-term care insurance policies. What are reverse mortgages? When to use Medicaid to pay for long-term care. What you need to know about annuity-based long-term care and the Pension Protection Act. Asset-based long-term care solutions. The long-term care strategy using IRA money. The vital legal documents you need for long-term care planning. How to use veteran benefits to pay for long-term care. Download the report, get long-term care, get ltcreport.com. All right, some other Medicare myths that I just want to make sure that we go over. A lot of times people get super confused about Medicare. The first myth we want to talk about, I must have to pay a fee to use a broker and get their help with all this. So the truth is, I'm a Medicare broker. We do not charge any fees. We don't ever charge a fee for service. In fact, we're paid by the insurance companies if we assist you in enrolling in a plan. They pay us a commission, you don't. But our interests are in you. So you don't have to worry about us charging you a fee. The second myth is nobody works for free, so the insurance company must charge a higher price if you go through a broker like me. Not so. You pay exactly the same price whether you call the insurance company for a quote or you call me for a quote. It's the same exact plan. It's the same exact coverage. So working through a broker, what we have access to is multiple plans. We go to Medicare.gov. We check out the rates online. We have different tools. Although we don't offer every plan in every area, we do our best to be contracted with as many as we can so we can help you enroll in the right plan for you. But you won't pay more if you work through a broker. All right, myth number 3, if you get paid by the insurance company, you must have a bias towards one versus the other. Quite honestly, there are hundreds of different plans available. I don't know which one pays me more. My job and my goal is helping you, and we have access to over 25 different companies. They all pay me about the same. I want to make sure that I'm getting you the best price, the best deal, the best coverage based on you. I don't want you to overpay because then you're going to overpay over time. So our job is to make you, help you find the right plan without overpaying for what's needed. All right, so the 3 truths of using a broker: no fees. The price is exactly the same whether you call the insurance company directly or you work with a broker. We have access to over 25 Medicare supplement plans, the Medicare Advantage plans. Some folks have 40 options, others have 80. We have we're typically contracted with all those companies if we can be, so that we can help sort through them to get you matched up to the right company. So our bonus is on retirement planning and protecting your savings. This is one of our clients out of New Jersey. Really awesome. We love our clients. We love to help you. And we want to make sure that we're helping you not just with Medicare, because the transition needs to be complete. So imagine you could wave a magic wand, know that you had a rock solid plan in retirement, and that you could live out your golden years in peace. Now, I have helped thousands of people transition from the working world into Medicare. I did it even before I was working as a Medicare insurance broker. I was on the other side. I was in HR, and I understand that people are concerned about outliving their money. If you love to travel, if you want to spoil your grandchildren, if you want to leave education or a legacy, we want to make sure that you have enough money to get it all. Pay less in taxes. A lot of folks, that's a big thing, and have total financial freedom guaranteed for life. These are some of the things that we can help you with. We'll get started with Medicare. Always start there, but then we can help you figure out the rest. So most of us, we don't think about retiring until we get to the end here. Maybe we had a 401k, or if you're self-employed, you had a solo 401k. Maybe you set up a Roth IRA. If you work for a school or something like that, you have a 403b. These are employer provided benefits. We also have different strategies like market driven accounts. You might have invested in the stock market. Maybe you had a parent who left you some money from the stock market and you have a broker outside. That is another way that you're saving for retirement. Again, some of you will have checking, savings, CDs, precious metals. So when we look at your retirement, we look at where you have your money. Some of you will have money that is inherited, left to you. Most of you don't win the lottery, though. That is probably not the place where you're going to get your money. But these are the three big buckets of where most of us have money for our retirement outside of Social Security. We have some kind of a 401k. Not many of us have a pension anymore. We're going to have money in a market like the stock market, or we're going to have savings. So those are the three big buckets. So we also look at retirement at this point a little differently than when we're looking at somebody who's 30 years old. You might have started out back then saving, and now you have this money. Our goal is to make sure you have income for life. There are several ways we can help you with that, help you protect the principal of what you have so that you're not at risk. We feel like when you're at this point of your life, you want to have something a little bit more secure, something with growth potential. The client you saw on the screen, we help them figure out how to get a fixed income for life. And just so great to be able to help people have that peace of mind, never worry about running out of money in retirement. All right, so there you have it. If you want to set up an appointment, we have different steps in Medicare. Today's online education was the first part of Medicare. Getting all your ducks in a row starts with being educated. There's a lot more material out there. You can go onto the Medicare website, medicare.gov. You can go on to the socialsecurity.gov website. We have different educational materials that are available. You can click the links below. You can schedule an appointment with us. Scheduling the free consultation, though, that gets you the personalized meeting with us. So it's free. There's nothing to lose. There's no obligation. We're not hard selling you into any products. We do ask you a couple of questions just so that we can understand where you are, what things we might recommend, and then you have the opportunity to ask us anything you want so that we can help you figure out what's right for you with Medicare and retirement. You'll also receive a couple of free items from us, a personalized roadmap. We have a nice folder and brochure that we send out, the cost of Medicare summary. Medicare is not the same for everyone, so we want to make sure you know what your costs will be. And our relationship with you will be for a lifetime. So if you want that, if you choose to become a client with us, we will help you every step of the way, no matter which product you choose or don't choose. Our goal is to help you keep the best plan for you, specifically with Medicare. We pride ourselves on following up with you. You get regular checkups with us. We frequently send out physical mail, emails, text messages. There's so many ways to communicate with you guys, but most of all, we want to make sure that you feel good about that. You can always pick up the phone, talk to me or one of the other agents on staff. There's no shortage of us. And if you have a problem with a claim or just a general question, we're happy to answer that for you. And that is for your lifetime. We're not going away. Not anytime soon. All right, so you can schedule a consultation by going to the links below. You can schedule www.medicarebylenore.com. That gets you right to my calendar. You can get your free personalized roadmap for Medicare, the Medicare cost summary. We'll also send you out a nice book if you like. So go ahead, subscribe to our channel, check us out. We have some other great information. Appreciate you sticking around to the very end and look forward to talking to you soon.